Hi, I'm Shami Lochanlal, your host on Speak Your Mind, and a very warm welcome to my guests on Speak Your Mind, Dr. Eferemi Wangainambete. You are the Associate Professor and Surgeon with CWM Hospital. Thank you, Doctor, for accepting the invitation on Speak Your Mind. And with me, I've got Ashok Muni, who's the General Manager of Smart Lab in Suva. Thank you very much, gentlemen.
Thank you.
For agreeing to come on a Talkback show, and especially when our topic is about Pinktober, breast cancer. Normally, it's a situation with women, and there's a lot of awareness on Pinktober and breast cancer. So, Doctor, what does Breast Cancer Awareness Month mean?
Thank you. Breast cancer is now the largest form of cancer in Fiji, and it's increasing around the world. It's estimated in the Western world that 1 in 9 women in their lifetime will get breast cancer. So that's a very real and very, obviously very intense number if you look at it. Which means that, in a woman's lifetime, there's a 10% risk that they will have cancer. In Fiji, it's now the most common cause of cancer. The Minister of Health numbers seem to be indicate anywhere from between 300 to 400 a year, and those are the numbers that we see. It doesn't include those who seek other alternative forms of treatment. And so all around the world there's been a push for advocacy and raising awareness, and that's what Pinktober is all about. Pink obviously is the color that is associated with breast cancer.
And pink is to do with women, maybe, because that's why,
But again, it's going back to the fact that it's the most common cause of cancer, period, stop, in Fiji. And number two, it's also the highest killer in terms of cancer in Fiji. So, obviously that's the challenge that we are up against, and that's why, as a medical and health fraternity, we obviously we support the efforts of everybody around Pinktober, because the quicker we have patients presenting, and then the likelihood that there could be a cure.
Doctor, you mentioned earlier that there are about 500 or some cases of breast cancer in women every year, right? So 355. That is every year, and you see the number increasing, maybe because of more awareness. Women are coming forward for tests and all that. So are these is there an age bracket as where you see more breast cancer patients, or when does this happen?
The age bracket is between, the median is about 50, so 50 to 55. So anywhere in between 40 to 70. That's where we see the majority of the women. Again, you have women that present occasionally. There's a few that that are off the graph. So there's a few that present very early in their 20s, and there's a few that present very late. But roughly, just the thing we need to understand is cancer is the disease of the aging. So the longer we live, the likelihood that we'll have cancer from something. And if we're getting cancer very early on in life, or in the middle of life, which is about 50, that means that all the body's immune and defensive mechanisms have broken down. And they've broken down and allowed cancer to come through quite early.
Ashok, would you like to?
Yes, it's very important to realize that breast cancer, this is the month in October when we all focus on this thing. I am an activist on health and preventive health, and I would like to see a lot more effort put in the prevention of cancers. It costs us way too much when we are dealing with treatment. Cheapest way to deal with any disease, including cancer, is the prevention.
Ashok, you have a smart lab in Suva, right? And you're the general manager of that smart lab. Do you see a lot of women coming for their tests when it comes to breast cancer or any other test?
Well, we have been going around. Well, interesting that we have been chosen by the Fiji Cancer and the Suva Golden Oldie Rugby Club to do their outreach, the PSA and the cancer outreach for men over 40 and women who are 40 plus. As the good doctor alluded, breast cancer comes about generally around post-menopausal area. That's the time when these things generally occur. Of course, there are exceptions, because there will be times when the reasons are genetic and family history and things like that, in which case it could come much earlier.
So are you saying that when a woman reaches her menopausal age, that is when she should go for a breast cancer, a test?
I think the most important thing to remember is the greatest risk of having breast cancer is being a woman. So, any woman at any age, if they feel their breast is not normal, or they feel any lumps, they must present themselves. What I'm saying is the biggest number, the peak incidence is in that period. And so if you look around the world, that's where screening comes in. So screening mammograms happen in that period because you pick a lot of women in that period.
Yes.
But as I said, any woman, even a younger woman who's got any lumps or anything that they're worried about in their breast, who present themselves quite early, because there's always a likelihood of having cancer quite early. And as my friend here has talked about the genetic aspects of cancer in Fiji, because we don't have the genetic testing, we don't actually test it quite rigorously. But we know that there are potential for genetic forms of the disease. Yeah, think about Angelina Jolie. Angelina Jolie, her mom had breast cancer, and she had the genes, and that's why she had, prophylactic mastectomies to be able to prevent her from having the cancer. So we don't actually know at the moment who's got the gene or who has got the mutation of the gene, in Fiji. And whereas in New Zealand or in Australia, whatever, they know. When I was in New Zealand, did some training in New Zealand, those who are come very earlier, they have the disease, they're suspected to have the gene, testing is done, and the geneticist then begins to map them. So we know that in this family, we've got to keep a close eye on them. We don't have that. So I think the most important thing is awareness, people presenting early.
So let's talk about how important is breast cancer awareness in Fiji. There is awareness every month, but how important it is?
Well, when something is going to cost you your life, it is very, very important.
Are we able to reach to women in urban areas only? What about women in rural areas? How effective has this awareness program been?
Yeah, I like that question, because that question, we talk about the rural areas, but you've got to remember that a huge number of the population is in the urban and peri-urban population. So that I think we have to think both sides. I think it's been estimated that nearly 50% of Fiji population now lies between the Lami-Nosori corridor. And the question I keep on asking myself, what's happening to that 50%? And easily about maybe another 30% in the other towns.
Yeah,
so
because women living in urban or peri-urban centers, we are able to reach them because they're centrally located. But in areas in rural areas where transportation could be a problem, or living, over the sea areas, so that's a concern. We'll take a break here, Doctor, and when we come back on Speak Your Mind, we'll continue where we finished here. So we can talk about how about women and the centers in rural areas. And of course, I am aware that Fiji Cancer Society is also raising funds. We'd like to know how is that being used and what are some other helps available. So we'll be back right after this short break. Welcome back on Speak Your Mind. My guests are Dr. Ephremi Wangainimbete, and who's the Associate Professor Surgeon at CWM Hospital, and Ashok Muni of Smart Lab. We were talking about women in urban and semi-urban areas. Who is more prone to breast cancer, women in rural areas or women in these urban areas?
Yeah, I like the question because it's a very general question. But if you look at all the risk factors for breast cancer, which is being a woman, using the oral contraceptive pill, having children at a later stage, and the associated factors such as stress and smoking and so forth, you probably think that the women in the semi-urban and the urban areas are more at risk than the women in the rural areas. The thing that worries me is that there's been some data that's coming out from other areas, not exactly breast cancer that are beginning to show that that a lot of late presentations actually happen in the peri-urban, semi-urban areas. My thoughts are, again, this is my only personal opinion, because sometimes in the small places, like in the island I come from, there's only about 1,800, 2,000 people. There's a doctor and there's a few nurses. So the ability to reach the population is probably a bit more
accessible, yes,
than in a densely crowded area. You know, for example, give an example like Valley Level. You know, it's a densely crowded area.
The Sinuis.
The Sinu. So I think that's one of the challenges we have.
You know, we have earlier on, I think we alluded to the fact or talking about rural communities. My lab has been going to rural areas, and we've been doing NCDs screenings as well as the cancer, as I earlier said. And we went to Netasiri in the Bunendawa, Nakrosole, out a fairly remote village there, and other ones at Nasilai or others, but many places. And one thing we noticed that the women particularly have this mindset, they don't want to talk about breast cancer or ovarian cancer or cervical cancer, because it's a subject that they're not comfortable talking about. And I think there has to be an effort made to change this mindset, that these are essential bodies, our anatomies, and they cause or give us good health or bad health and death.
Definitely.
And therefore we must address them as they are and what they are, instead of being ashamed to talk about their breasts and others.
And we mentioned earlier that the huge population lies in between Lamy to Nosori corridor. So how much work do we have to do in these areas of creating awareness?
I think one of the biggest things that we can do is obviously, obviously, thank you for the opportunity today, is, the media awareness, the ability to have awareness again in communities. I know, for example, some of the health centers have been running their own awareness programs. I was quite fortunate to be part of the Raiwanga one about 2 weeks ago, and it was interesting seeing some breast cancer survivors come, and also some women just turning up. They heard about it. So I think this pocket, small meetings, and the big media awareness, I think they're all helpful. But again, it's the sustained, during not only during the month of October,
yes,
but it's beyond that. What do we do beyond October? That's the question.
That's true. Absolutely correct. The good doctor is right on the money here. It's our responsibility, not just how to create awareness. Who is going to do it? I think in our country, in our situation, the media has the reach. The radio has a reach. The TV has a reach. And if we are trying to change the mindset of the general population, please get yourselves screened. Come off, get yourselves screened. Take some responsibility for your own health. Unfortunately, we are not doing that. We do all the bad things in our lives, in our lifestyle. We make bad choices, and we expect somebody else to look after us. And I keep always challenging my friends and relatives and others whom I meet during my outreach in the urban, the rural areas, that they should try to correct their own lifestyles that will affect their own health. And it's very important. I cannot live a healthy life for you. You have to live your healthy life for you. A doctor can't save the life if you're not going to help the doctor staying, help me or follow his directions or look after him.
So increased awareness and being proactive for wellness is a good thing, and we're talking about it.
Absolutely.
And every month we talk about Pinktober, pink parades, pink ribbons. But how are we progressing with education and progress in this area? How are we progressing with treatment? How are we progressing with equipment?
Yeah, we are progressing quite well. I started working as a doctor about 20 years ago, and I've had the opportunity to work in New Zealand, and I've seen us progress, leaps and bounds in terms of cancer treatment. We now have, probably outside Australia, New Zealand, the first country that has its own medical oncologist. We have somebody who just also came back from New Zealand. We now have specialists in different areas. that's something that we didn't have 10 years ago. We have drugs that are now available, and so the treatment has progressed. But coming back, I think the important thing to understand is there's three things that determines a patient's outcome. The first thing is how fit the person is before they have the injury or the cancer. And a lot of our people are not fit. I'm not just talking about, looking fit. I'm talking about actually aerobic fitness, eating the right things, keeping off the smoke and so forth.
Yes.
That's number one. The second thing is how aggressive is the disease that actually affects the person. Okay? And then thirdly, the treatment. And many times when patients come, they come late stage, they haven't looked after themselves, and they're expecting the treatment to do miracles.
Miracles, yeah.
So I agree with you. So obviously the most important thing is encouraging our population not only to seek help early, but also to be healthy, to aspire to wellness.
That's true. So here we're talking about breast cancer in women. How important is a woman's partner or a man in their life to support them? Because most of them are not coming out of their shells. Is it because they're not getting the support or not getting the attention? What could be the reason?
I don't think. Well, it's very, very important. But a lot of men, chauvinistic, I should call them, will not discuss a woman's health with their wives. If the wife will complain about something, that's a women's problem kind of thing,
Well, it's good we're hearing from the horse's mouth.
Yeah. Not in my case, but
no,
yes,
the discussion is how
heard that.
How can men help?
Yeah.
Yes.
We have data.
We have to.
Yeah,
We have to create that awareness.
Yeah, we have to. We have we have data at the FNU. I did a small study on the knowledge and attitude and practices of men towards contraception and women. And it's interesting. A lot of men actually give the final consent at home. They give the final consent to go to the hospital, final consent for nearly everything. So I agree with you. We have to work on the men.
True. It is interesting that what we found during our PSA screenings, that the men are so afraid of what it may cause if they went in and got themselves treated for or things like that, Just like the women are very conscious about their breasts, the men are also very conscious about their genitals, anything around there. So, it becomes very hard for them to, and we live in a traditional families mostly. We are not as westernized as sometimes we think, but these are important things that we do not talk about.
Yes, and I think it's important. I'm so grateful that Doctor, you're here, Muni, you're here to talk about this, to support women and to encourage men to give their women their support. Another break, and we'll be right back to continue this very important and interesting topic on Pinktober, breast cancer in women. This is Speak Your Mind, and if you wish to call and ask Dr. Ephraimi or Ashok any questions related to breast cancer and Pinktober Awareness Month, please do call us on Speak Your Mind. So while we're talking about Pinktober, what are normal breast nodules and how often should a woman get a mammogram?
When you have diseases of the breast, you basically classify them into cancerous and non-cancerous diseases. And it's important to understand that the non-cancerous diseases of the breast, whether they be nodules or discharge, they will never become cancerous. The cancerous ones, when you've got the cells going off to become cancerous, they begin as a small lesion and then they continue to multiply, the cancer cells multiply until you have a fully blown cancer. And so when women come in, because cancer is a killer, we treat every nodule as if they were a cancer. And then, so in a rough estimate, if we see 10 women that come to our clinic with nodules, and we say it's a cancer until proven otherwise, will only be about 2 or 3 will actually have cancer. The other 7, they don't. But we know that because we do the tests. So, we take some pieces for testing, take some x-rays, some scans, And at the end of it, we say, oh, you're really fortunate. And I think that's the way it should be. It should be cancer anti-improvement otherwise, because it is a killer.
So if anyone in the family has been diagnosed with a cancer in the recent past years or whatever, or in the family, should it be of concern for other members in the house, and would it be a risk?
Yes, by all means.
Yeah. Again, family history is a very important risk factor. And if you have first degree relatives, they're even more important. So I'm talking about mom, sisters. Now, if you get like 2 or 3 generations, so mom, sister, daughter with breast cancer, then you're looking at a genetic mutation. So, so obviously family history is very important.
To support a loved one, let's go into the treatment, and a loved one has got breast cancer. To support that person towards the treatment, what should and shouldn't one say to a breast cancer patient, not to say something that is insensitive? There's certain things someone, how some people say, oh my goodness, so that's a killer disease. What are some things that we should be cautious about?
I think we have to use a common sense there. What doesn't make someone more anxious? Instead of making them more anxious, we should be working on something that'll give them some peace. And acceptance is one of those things. Okay, so now we have this. Let us do something about it. And I am going to support you, and I'll still love you. I'm speaking from a very personal perspective here. My own sister, elder sister, went through this same process, and my brother-in-law was the opposite side of things, and I was clashing with him so all the time. And this was one of those things. But I couldn't blame my brother-in-law. He was a normal male chauvinist. I don't want to say pig, but that's the kind of person he was. But he will not accept the fact that it was somehow my sister's fault. It was the woman's fault. Why should she get sick?
I think it's not a deliberate one, but it's just the reaction people have and comments. There are times when
ignorance.
Yes, ignorance too, and then and also because of ignorance. And I think it's time that it's time to learn from each other, because someone may not have cancer, but if I happen to know, say, oh my goodness, my aunt had it and she died. So those are some things.
We've changed the way we talk. I mean, you'll see nowadays that doctors will no longer say you've got 1 year left or 2 months left. Now it's gone. It's out of the window. What we do, the talk now is, what is your chances? What is the possibility that you may be alive in 5 or 10 years? That's called a prognosis. So that's changed. And we say to the patient, look, obviously you're up against it. Your prognosis or the likelihood that you'll be around in 10 years is probably 30%, but you can be in the lucky 30%. We are not God.
Yes.
You can be in the lucky 30%. If we just go through with conventional treatment, you could be the lucky 30%. And we've been wrong, before, where we've thought that, the cards are against the particular patient, and they do make it. Miracles do happen. And I think the most important thing is, the thing that we keep on reminding patients and their relatives, is that cancer treatment is a step-by-step progression. And we just need to make sure that at the particular step that is done. And at the end of it, we can look back and say, oh, we actually have a cure.
Yes. So while we're talking about cure, right? Do we desperately need more research to turn breast cancer into a manageable disease for all women, not just for some?
There's been a lot of research in the world. Breast cancer is one of the most researched topic, and the reason is a few things. Number one is obviously the numbers are big, but more importantly, it's women. So women obviously have driven a lot of funding into this cause. What we're beginning to do in Fiji is actually look at the data from overseas and beginning to see whether it actually relates to what we are seeing here, or are we seeing a different spectrum of the disease. And there's been some data that we've been seeing. A few things that we've noticed is obviously we have women presenting late. We know that is a fact. And secondly, we also know that our women, to an extent, behave similar to the different type of cancer, the breast cancers that we see in the Western world. And so the question that we are asking ourselves as clinicians are,
why?
Are we has developed now.
Mm-hmm.
It's a developed world.
Why are women so prone to breast cancer? Just very quickly before we take another break. Why is it so relevant in women?
So the likelihood of cancer is based on a few things. Number one is the amount. So men too have cancer.
Yes.
But 100 women to 1 man. In Fiji, the rate is about 2 to 100, which is 1 in 50. So number one is the amount of breast tissue. So women have a lot more breast cells. The second thing is the women hormones that play an effect in terms of, enhancing the cells and reducing it. So they're like fertilizers, for example. And if you've got a cancer that's going on, they've got a cell that's going off, a hormone can actually provide like a fertilizer to encourage the cancer to grow.
All right. We'll take a break and then we'll be back with our fourth segment, Dr. and Ashok. So do stay with us on Speak Your Mind. This is Speak Your Mind. I'm your host, Shami Lochan, and I have a caller, Dr. and Ashok. Let's put up, see what this caller has to say. Welcome on Speak Your Mind. Hello? Okay. Never mind. So I have a question from a listener here who says that what psychological care is provided to men and women who are diagnosed with cancer?
There's a few support. Number one is we have a dedicated cancer unit at the hospital, and also in Lotoka and Lambasa, there are dedicated nurses that actually look after cancer, apart from the doctors. So number one. Number two is apart from that, there's Fiji Cancer Society, and also we have counseling services. At CWM, it's provided by the Pacific Counseling Service. And then you have, obviously the laymen and women and pastors and ministers and priests that are, given visitation rights by the hospitals to actually come. On top of that, during the treatment, there's several meetings that happen within doctors that are looking after the patient, and with the doctors and the patient. And easily we can throughout the the first day of the treatment, we could probably be meeting with the patient and their relatives maybe about 7 to 10 times. Obviously there are patients who want to meet more, and that's a bit of a challenge sometimes, but there's a lot of meetings, a lot of discussions that happen.
Let me add something to that.
Yes,
the
please.
Fiji Cancer Society, I know, does a lot with recently identified cancer patients, and they even go and visit them at their homes. They take people who have had cancer, go with them as well, and I think that's it's a great thing for a new cancer diagnosed patient to have a support from someone like that.
Yes. So for survivors, they may have concerns over their body image, depression, anxiety, something we're talking about, and sexuality need to be addressed. Is there any kind of emotional and physical aftermath or treatment for survivors of breast cancer apart from psychologists?
That's a medical question.
Yes.
Certainly, the support is there. Simple things such, for example, like breast fillers. So where they've had the breast taken out, they can have a filler that goes into the bra to actually make sure that they maintain their shape. The Fiji Cancer Society organizes meetings by which we get other survivors to come and talk. As I said earlier, we see them quite regularly in the hospital system, because they have to come back and we have to review them. And it's not necessarily just one doctor, there's a few of us. So, I could see a patient who says, doc, I've seen the medical oncology last month, I'm seeing the oncology nurses next week. So the safety net is actually there for them.
What kind of services can patients or women who have breast cancer can avail from Smart Lab?
Okay, we are mostly with the blood testings. Now, there are two sides to this story. There is one school of thought that likes to knock it out, and the other one says that it's very beneficial because the blood testings provide tumor markers. They're not diagnosing that the one person or a positive result out there does not mean one has cancer, but it does provide a pathway for a doctor to follow. and rule out or confirm if there is something. So that is what we are trying to promote here. And we believe that prevention is the cure. And if detection is early, the doctor will agree that the treatment works better, and the longevity is increased, and it is better overall, and it's much less costly.
Dr. Ephraimi, for patients who have had breast cancer, is it possible for them to for them to go back to their normal life of treatment after after being treated, especially when they're married?
Of course, they can go back to their normal life. They can go back to their occupation, so whatever it is they teach, administrator, manager.
What about a couple when it comes to their sex life?
Yeah, I mean, obviously the advice that is given to them is, is obviously losing a breast doesn't mean that they have lost the mechanisms to be able to be intimate with their husband. It takes a lot of accepting, though, on both parts. And as you know, in overseas, obviously they ask for a new breast,
Yes.
and that's what's done. So so some of them they ask for new breast. The most important thing, even in overseas, even in New Zealand, when I worked in New Zealand, when we talked about getting a woman a new breast, the most important thing remains is we have to be sure first that all the cancer cells are out.
Are out, yes. Yes.
So there's always a risk that, in trying to give a woman a cosmetically acceptable result with a new breast, that you might actually leave behind some breast cells that has cancer.
So these women, do they still struggle or face emotional issues?
They do. I think that's, losing any part of your body is difficult to accept. I had to have my tooth pulled out once, and I said to myself, it's just a tooth. You can imagine the women, imagine those who, lose their legs. It is quite an emotional experience.
How can men support and help their wives who have been through this situation?
One thing that we do try and put across to the family so that they can accept is to say, it's important for mother to be cured first, because there is no use, having no mom. And I think the important thing to understand too is in our culture, our women become accepted as leaders, later than in the Western culture. So when they've had children, when they're about 40s or 50s, when cancer actually, breast cancer comes in, it's different in the Western world. So I think it's important to ensure that our women are looked after quite well, and they are valued.
Yes, it is very, very important that the women pay attention to themselves and their bodies and their health. I have known many men who have this phobia of intimacy only after a hysterectomy, let alone something worse. And this is a mindset we have, and like Dr. alluded to, the cultural thinking that is amongst our women. Mostly our women, when they get 45 or 40, they think they're too old, and that's it. They've got grandchildren now.
Well, why we say life
it.
begins at 40.
Everything changes.
Yeah.
Whereas this mindset has to change.
Yes, definitely.
And it will only come out of education, out of talking, and not being ashamed to speak about it.
And the love and the emotional support that they need from their better halves is very important.
Absolutely.
Yeah.
Absolutely.
We'll take another break, Doctor, and thank you, Ashok, for being on Speak Your Mind. If you do need breast cancer tested or cancer tested, please do go to Smart Lab. You're based at Tapu City in Suva. And Doctor, I'd like you to continue the last segment with me soon after this break. So we'll be right back. Welcome back on Speak Your Mind on Gold FM. Mario joins me on this last segment. Mario is the program director for Today FM, and I've got Dr. Ephraimi here with me. So Breast Cancer Awareness Month has done an enormous job of fundraising for breast cancer patients. So if the public becomes educated on where their dollars go, they make investments that more closely align to their passions, and that's always a good thing. So Doctor, there's a Pinktober symposium happening. Let's talk about this, and also we'd like to know, where does the proceed go to after fundraising?
The Pinktober Symposium is run by Fiji National University and the Fiji Medical Association, and together this year with the Fiji Cancer Society. So basically, it's a whole day program, the 27th of October, on a Friday, where for 3 years in a row, and this is the third year, where we actually have speakers who are specialists in their own field, basically breaking it down and making it into simple terms. What is cancer? The investigations that we use, the treatment that we have. Are we same or far away from our Australasian and Western world counterparts? So basically, it's like cancer made easier. That's what the day is all about. But
so it's a whole day program.
It's a whole day program.
So who attends this program?
So it's open to everybody, to the public. We send invitations. So mostly we've had health professionals come, but we also invite other people from other places to come. One thing that we do have, we are very wary of the fact that some business houses have their own small health committee, for example. So these are the people that like to that they can come and also be part of this, so they can learn. Because I think it's important, as we talked about earlier, that the more we know about this, and then the stigma, number one, number two, the fear around it, it begins to get lost, and so the light goes through the darkness, sort of thing. And I think that's the important. So basically, it's cancer made easy, just understanding what the terms mean, and then being able to network and connect during morning tea, lunch, and so forth.
Yes, Mario is here, and we have 6 radio stations on Canavan Street, right? So we use the Today FM and our 5 other radio stations windows to do bra art competition to create awareness. And we have a lot of people who pass by and they do notice that. Now, Mario, you are planning something to create awareness on breast cancer. Would you like to talk about that?
Okay, yes, thank you. The idea that Today FM is brought about is called the Today FM Stilettos Run for Cancer. Now, because this is Pinktober and the focus has always been on breast cancer as a whole, but for Today FM this year, we wanted to make it more creative. Creative in the fact that you would have an event that would fundraise for cancer, but also leave an embedded image in individuals and their mindset that they will remember that this is for a cause, it's for something good. Now, the charity event is first of its kind for Fiji because it's called the Stilettos Run, and it's quite self-explanatory on its own.
So who's going to wear the stilettos? Are you getting to focusing women or men?
We're inviting people to join us on the 28th, which is the Saturday after the symposium, I believe.
Yes,
we'll be there.
yes,
Yeah, and it's $10 per person, and all that you require is to have stilettos. You don't necessarily have to run. But it's the fact that you are trying that is the most important fact, because you have to think about those that are currently fighting cancer or those who have survived. They are fighting impossibilities every day. And, donning on a stiletto is also trying to break the stigma as well, especially for the guys. We've got ladies who are interested in it, and surprisingly, a lot of guys who have been challenged. So for us, we want to challenge everyone. Come. Give it a go, because
and especially business houses too, if they want to sponsor a listener or some. I think this would be good, Doctor. Doctor, you work closely with Fiji Cancer Society, right?
We do.
So definitely the money which you're going to raise here through Mario, through these stilettos fundraising awareness on breast cancer, will this money also go to Fiji Cancer Society?
Indeed, that is the entire aim of it, is to raise funds. Not only that, but to also educate people about cancer as a whole and how it has affected our communities. We have people who have family members who have passed on because of cancer and so forth. But the idea behind the Stilettos Run is also the focus will be on, I would say, the guys. It will be interesting to see the guys give it
wearing it, actually
wearing the stilettos and giving it a go. We won't obviously make the whole distance, but the chance, and not the chance, but the fact that you would try it is beyond borders.
Experiencing sort of like being a woman, womanhood, how we carry ourselves, how we juggle the
Exactly.
balls in our lives of different things which
So
we
the saying
do.
of wearing, being in someone else's shoe, it's
Stepping in our
more
shoes.
literally in
Yes.
this sense.
Okay. So, doctor, what happens to all these proceeds after fundraising?
And I was just going to, talk about that. I think it's important to realize that this type of money that goes towards the NGOs like Fiji Cancer Society, like WOWs, are so important for doing the other things around, apart from the hospital. So, for example, Fiji Cancer Society, for any woman who has got breast cancer, simple things like taxi fare so that they can come in and have chemotherapy, buying a filler for their implant, for their bra, being able to ensure that they have some toiletries on the side of the table when they're about to have an operation. Now, those type of things in the Western world, I mean, the social welfare and so forth is so strong that it's able to support them in that way. We don't. So that is actually being taken over by these organizations, and the money that we fundraise actually comes back to help us. So I'm very pro Pinktober, because I know that money comes back to support the patients that we look after.
So when you have your Pinktober symposium and your Stellatos, your main aim is men to come and support. You want more men there, or you are looking at both?
Ideally, we would love to have a lot of men, because at the end of the day, the support network has to be there, and men play an important role in the support network. And for them to just come out and to show their support, that is a milestone on its own. So it's actually the invite is for everyone, whether of gender, whether it be a male or female, but it'll be really, really awesome and ideal to have the men show up as well.
And I'm proud of both of you, both men here on the Throwback Show today on Speak Your Mind, to come forward to advocate, to create awareness. And of course, I'm sure all other men will be very encouraged to see Dr. Ephraimi and I was going to say Dr. Mario.
Dr. Mario,
That could work.
Yeah, for this. Doctor, what is one word of advice to general public or those who are going through breast cancer treatment, or just a word of advice?
I like to finish by saying that we are blessed in this country that the health system is free, and we should make a full use of it. Make use of our tax whenever we have any problems, front up and be seen, and obviously when things are smaller and they are more treatable, then cure is a possibility.
Thank you very much, Dr. Ephraimi, for being on the show. And Mario, thank you very much.
Thank you.
I'll see you next week on Speak Your Mind with psychologist Offa Swan, who's going to be my guest on Speak Your Mind next Tuesday. Take care, be safe.